Hi, today I'm going to show you how to draw up your peptides and give yourself self-injections. So I'm not going to actually do it, I'm just kind of demoing it. But what you're going to do is take an alcohol wipe, and every time you do it, you're going to clean the top. This has already been opened, but it'll be sealed with a metal flap, and you just have to use like a paper cutter or a knife to pop it off, and then you'll still have that gray rubber part. You're never going to take the whole top off. You're just going to be puncturing that gray rubber every time. And you're going to get a kit with a bunch of needles. So you have to take the bottom part off, which is just a safety, and then here's the needle. And what you're going to do is you're going to pull back to whatever dose the instructions tell you. So for example, if it's 20, then you're going to pull back to a 20, and then you're going to puncture it and you turn it upside down, and then you have to inject the air into the vial and then pull back to the 20 again. And sometimes it's hard to tell if there's liquid in there. You have to just kind of play around with it and see and make sure you got the liquid all the way and there's not much air, and then you'll be ready for the injection. So then for some peptides, we do it in the belly area. So what you're going to do is you're going to clean off, find a spot on your belly that has a little pocket of fat. You clean it with the alcohol, and then you're going to pinch it, and you just go straight down and push it in. And then other peptides, like for example, if you have a knee injury and you're using BPC, we don't inject it into the joint, but you inject it near the injury. So what you would do is squeeze your knee and just go right there. I've also had a calf injury where you don't have as much fat there, but you just have to pinch your tissue, and you may have to go a little parallel so you don't get the muscle. You're just trying to get the product in the subcutaneous fatty layer as close to the injury or the target area that you're going for. So for things like semaglutide, you're going to be doing that in the stomach fatty area. For BPC 157, you can either just do it in the stomach area if you're just trying to do overall healing, but if you have a specific injury like your knee or your hip, you try to do it closer to that. And I also recommend for the stomach alternating sides each time, because it can be a little irritating, so you don't want to always do the exact same spot. And same for the extremities or other injuries. You don't always want to do the exact spot. You just kind of, each time you're going to go around the area and do a slightly different area each time. So I hope that was helpful, and just let us know if you have any questions.